Hello friends, good morning. Today we are going to delve and going to understand about F40 and F41 related codings of International Classification of Disease, Mental and Behavior Disorder. F40.0, that is Agoraphobia, F40.1, that is Social Phobia, and F40.2, that is Specific Phobia. We are also going to discuss today about F41. The decoding for F41 is F41.0 means panic disorder, F41.1 means generalized anxiety disorder, and F41.2 means mixed anxiety and depressive disorder. So today we are going to discuss little bit about each and everything that just I told you. 3 things related with phobia and 3 things related with anxiety. First 3 things related with phobia is agoraphobia, social phobia and specific phobia. Next 3 things we are going to discuss is panic disorder, generalized anxiety disorder and mixed anxiety and depressive disorder. Earlier we have already gone through agoraphobia, and agoraphobia means marked fear or avoidance of any 2 situations of following: either entering into the crowds, public place, traveling alone or traveling away from the home. And this situation, whenever the person have to face, they either avoid or try to escape out of this situation as early as possible. But when they have to face this situation, there would be a different kinds of anxiety. So the first kind of anxiety that comes, that is autonomic arousal of the autonomic nervous system, and because of that few symptoms arises, and that are signed by the few symptoms like palpitation, pounding heart rates, acceleration of the heart rate, sweating, tremor, trembling, sacking, dryness of the mouth and dehydration like feeling. Similarly, apart from this, symptoms related with the chest and abdomen may also faced by the person, like difficulties of breathing, feeling choking, chest pain, discomfort, nausea, abdominal distress, churning in the stomachs. These are the symptoms related with the chest and breathing system. Similarly, symptoms related with the brain and mind also being encountered by the few peoples when they are facing this kind of situation and when they are suffering from agoraphobia. Those symptoms of brain and minds are feeling dizziness, unsteady, faint, lightheaded, feeling that objects are unreal, and feelings they are not real. That means derealization and depersonalization respectively. Sometimes numbness, tingling sensation and general symptoms of hot flushes and cold chills are also arises. They are so significant that it produces lots of distress and affect different domain of the person, like personal domain, social domain, occupational domain, etc. And before diagnosis of agoraphobia, you must exclude other mental disease, like it is not because of some psychotic disorder like schizophrenia, not because of some substance use, not because of some organic or physical illness, medical illness, surgical illness, critical illness, or not because of some trauma. After excluding all this, we can make the diagnosis of agoraphobia. So we have completed F40.0. Now about the social phobia. Social phobia means a fear, marked fear of being in the social situation. Social situation like in the public place, facing the public place. Before facing this kind of social situation, they have marked fear. So they try to avoid to face those situations, like a fear of being under focus of other people, fear of embarrassing, fear of humiliating. And because of this fear arising within the mind of the person suffering from the social phobia, he tried to avoid the situation, to face the social situation, and he tried to escape very fast whenever they have to face the social situation, such as eating or speaking in public, encountering the known individual in the publics, entering or enduring small group or situation where the small groups are there. We have to face the small group. In that situation, the person have start to produce certain anxiety. Example, few parties, facing the party, facing meeting, facing classroom. So these are the situation. If this situation provoking different kinds of anxiety or feeling of being embarrassed by others, being humiliated by others, being under focus of other people, then this is known as social phobia. The code for the social phobia is F40.1. So again, these situations are very much significant and it's affecting all the domain of the person, most of the domain, working domain of the function. And before making diagnosis, you should must exclude other mental, physical situation or disorders, and you should must exclude the trauma on the head or substance use disorder or some psychotic disorder, surgical disorder, critical illness. The symptoms are not because of delusion, hallucination or delirium. Then only you can go for making the diagnosis of social phobia, that is F40.1. The next issue is specific phobia. Specific phobia means F40.2. Here the marked fear of a specific object or a specific situation. So there is a marked avoidance of such object and situation. Among the most common object and situations are the animals, bird, animals like a dog, fear of being close to dogs, bird, insect, height, thunder, flying, small enclosed space, flying or being in the small enclosed space, slight or sight of the blood, injury, injection, dentist, hospital, etc. So these are the specific situations that provoke anxiety within the sufferer, within the victim who is being victim of specific phobic disorder. Specific phobic disorder fall under the coding F40.2. So body related symptoms of anxiety also arise within the person who is suffering. So you should must see before making diagnosis that whether it is significantly producing the emotional distress, creating the emotional distress within that person or not, and it's affecting the different domain, functional domain, and you should must exclude the other situation, other disease, other disorder, other disturbances that may have a chance to produce similar symptoms. Otherwise the diagnosis would not be correct. For making the specific phobic disorder diagnosis, you should must exclude other critical illness, delirium, delusion, hallucination, psychotic disorder or mood disorder, mood and affective disorder or substance use disorder, organic disorder, if hormonal disorder, all if these things are excluded, metabolic disorder also, then you go for making the diagnosis of specific phobic disorder, that is under code F40.2. So we have finished agoraphobia 40.0, social phobia 40.1 and specific phobia 40.2.